Hi, my name is Tinu. I'm here to do my trach here. We've already suctioned the patient and we have a doctor's order to change the dressing and get a new tape on. Alright, knock on the door. How are you? Wash my hands. How are you doing today, Mrs. Smith? Can you give me your name and your date of birth? And then check that. Alright, so we have the doctor's order to change your dressing and get you a new tape and clean that place out, okay? Alright, we're going to get started. And I have my personal protective measure, I have my gown, and I have my face plate to cover my eyes and my mouth from any secretions. And I'll put that on, but really not going to put that on. Alright. We're going to take out the old dressing, okay? I have my red bag to put the dressing in, and I have my clean gloves. We're going to put on my clean gloves. Alright. So I'm going to take out your oxygen for a minute, okay? I'll take that out. And then I'll hold the face plate and I'll take out the whole dressing gently. Alright, and I'll check for odor, consistency, and amount, and I'll document that. And that goes in the red bag. Alright. The next thing I'm going to do is prepare to set up a sterile field for the dressing change. And I'll lift up this bed to my comfortable walking position, and the head of the bed is already elevated. So I'm good to go. I'll take that off all the way. And I have new bottles of normal saline and hydrogen peroxide, and they're new, so I'm going to leave it before I use it. So I'm going to kind of grab this part. Shake it, shake it, shake it. The outside, so I'm still sterile. I'm going to use a 1-inch margin for the outside. Shake it in. 1-inch margin. And that goes there. Alright. Let me get out of the way. So, what I'm going to do, I'm not going to turn my back on my sterile field. That's why I'm facing it. I'm going to dump that in there. I'm going to open this and leave it, and then pour my hydrogen peroxide half and half. Half of this, and then leave it. Pour half of that in there, and I'll put a large amount of normal saline in here. And those go away. So what I'm going to do now is go ahead and don my sterile glove, because I'm about to start to take out the inner cannula. So on my sterile here, I gotta be careful how I pick it up. So I picked up the inner part of it, because I'm gonna put this on this way. Make sure I do not contaminate anything. Alright. And since I got this sterile, I can always go back in there. Alright. So I'll move this closer to me for convenience. Before I get started, I'm going to make this end soiled, dirty, so I can take out that cannula and put it in my normal saline. Okay. For convenient purposes, I'm going to move this around. It's still sterile, so I'm going to move it around. Because here is still sterile. Push it towards me so I can clean it out better. Alright. Alright. Leave this clean. I'm gonna turn it clockwise. Make sure I hold the face plate. Take it out. You doing okay? Great. And that goes in the F and F part. Drop it in there. Let it stay in there. So what I'm gonna do is take my Q-tip. This end is not sterile anymore, so I'm not gonna use this. I'm gonna take my Q-tip, and that goes in there. Let it soak for a minute. Take it out. Go ahead. This is sterile. I can hold a faceplate and clean it from inside the cannula, inside the tip of the skin to outside of it. One time. Now dump it. Sterile. Go back in there. Put it in the normal sealing. Take it out. Hold the faceplate all the way. Clean it out. That goes in there. So what we're going to do is go ahead and clean out the inner cannula of the tracheostomy. Non-sterile hand goes in the F and F. Sterile hand takes off a little brush. So what I'm going to do is go ahead and clean it. Alright, great. Now clean it. Take it out. Clean it, take it out. Go ahead and put it in here because it's still clean. In the normal sealing. And kind of agitate it. Agitate it, agitate it. And that goes in there. So, sterile, clean hands. I'm going to go ahead and take gauze. Clean hands. I can put it in here and wipe off, just kind of clean the area of under the cannula, under the faceplate. Clean it out, clean it out, and that goes in there. So what we're going to do now is take this out. If I need to wipe it extra, I'll take my gauze and kind of clean it out. So I'll put it on my sterile hand. I'll hold the faceplate. Put it in there. Go ahead and turn it clockwise. Make sure I hear it cold before I leave it. It doesn't seem to be going in right now. Okay. Make sure it stays in place. Alright. Alright. The cannula is already in, so I really don't have to be sterile until I put this in there. So what I'm going to do is pick up my sterile gauze. Lay that there. Sterile. Pick that up. I can put it here because I don't want to touch it with my non-sterile hand. So what I'm going to do is lay that right there. Non-sterile hand. Lift it up and put it under my cannula. Just make sure I fix it in there real good. Almost there. You doing okay? Good. Great. Alright. Alright. It's in there. That goes there. So the next thing I'll do is take off this glove. I'll put a new glove if I'm a little sore. If not, I got my tape right here. What I'm going to do, it's already the cannula is in there, so I don't need to be sterile anymore. What I got to do is put this in there. So before I cut the whole tape, I put it into the space of the cannula. Just thread it through. It's a little hard, but alright, got it in there. So we're going to just pass this through you, okay? Right. And then thread it through there. Alright. And I'll make a double butterfly bow, so we can tie it back in there. Now make sure that the depth in there has 2 fingers breadth to go through, so it's not too tight. Alright, got it here. Now I got a butterfly knot one time, and twice through. Alright. So I have my scissors here to cut off the whole dressing. So I'm going to go ahead and cut the whole dressing and thread it out. Now make sure I monitor my patient for any respiratory distress, anything that makes them look like they need some hair, and I'll document the procedure and how they tolerated it, and I'll cover them up, bed in low position, cold light enrich, put back their face masks, their oxygen mask, of course, and then document the procedure